So a few days ago, I visited this private health facility where I do provide HIV care and support services. And while I was having this discussion with one of their unit heads, that should be the HOD of the lab team, I had this PS screen. I had it first time and I paused what I was doing. Then the sound came again and I was like, okay, well, I had to pause and ask them what's going on. Why are we hearing this scream? Is there an accident case or something? And they went on to tell me no, that it wasn't an accident case, that maybe the nurses are cleaning the wound of one of the patients um, who has an open wound. And I then asked them, okay, this patient with an open wound. No, they went ahead. So even before I asked them, they went ahead to tell me, family, you see this wound? Yeah, it's really deep and it's big. Like you can almost see the guy's bone in there. I said, okay, this person you are talking of with this open wound, is he where exactly is the wound? Is it around the ankle? They told me yes, that is around the ankle. How did I know? And I said, this person, is he SS? They said yes, that he's SS. A 24, I think they said he's 24 years old and SS with that open wound. So you see that very wound, you see that issue, that will be setting the tone for today's discussion. So today I'm going to be talking about leg ulcer, which is a very common complication amongst people living with sickle cell. So I'll be talking about the causes, what leg ulcer is, the causes, what triggers it, and how to better prevent and take care of yourself. Okay, so first of all, what is leg ulcer as it relates to sickle cell? So leg ulcers are open wounds. Typically, you find them between the knee to the ankle, and these wounds tend to take a long time to heal, usually more than 2 weeks, some years. So for some persons, it takes years to heal, while for some months, while for some weeks. So leg ulcers are open wounds from your knee down to the ankle. It happens around any of those it happens around those areas from your knee down to the ankle. That is where you get to see. I'm sure some of you have seen this wound, you've seen this sore. Some of you have it. I have people that have even sent me DM. I have people that have also followed up with their management in terms of the management of leg ulcers for other people living with sickle cell. One important thing you need to understand about leg ulcers, if not properly treated, it tends to reoccur. Like it doesn't just go once. You may treat it, manage it, the wound closes, and then maybe months later something happens, and then the wound open again. And for many people, this you see that leg ulcer, it doesn't just affect people. It doesn't just affect mobility for some persons because it's difficult to move around with that injury. Or for some persons, for some of them, it even leads to deformity because you tend to take that shape which you've been walking. Like that's you're not trying to while you're walking, you do not want to step on that particular leg with so much force, and with time you tend to assume that position when walking. Then for others, it affects them mentally because you're looking at this wound, you're doing all your best, you're trying everything you can do, but the wound just refuses to heal. It's still there, it doesn't want to go. So at that point in time, most warriors tend to become depressed. They tend to just lose. Some people lose the will to live because of that leg ulcer. So yes, leg ulcer can be disturbing, and not just in the physical or physiological sense of it, but mentally also. So what are the causes of leg ulcer as it relates to sickle cell? Well, I'm going to put it in a very simple format, so it will be easier for every one of us to understand now. For people living with sickle cell, the major cause of leg ulcer is actually poor circulation of blood around your body. There are a lot of things that causes leg ulcer, but at the end of the day, it still falls back on the fact that blood is not moving around your body like it ought to, which is why that forms part of the basis for treatment or management of leg ulcer. Whenever you're treating it, the main target is to make sure that now, when blood is not flowing around your body, the 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 final this thing there is just that oxygen is not getting to that part of the body. So because now blood is not moving around, what carries oxygen around the body is your red blood cells. And you get into a situation where your red blood cells are not moving as they ought to. They're not carrying the oxygen they ought to. Definitely it's not going to that place. And what happens when oxygen is not getting to any part of your body? That cell die. That organ, the cells around there, they die off because there is no oxygen getting there. Hold your breath for some time. What happens? So that's basically what happens with leg ulcer. Now, some of these causes include major causes of leg ulcer, like I've explained, and somehow you also have vaso-occlusive crisis. When you constantly have crisis, you're not hydrated, all of that. You're prone to leg ulcers. That is one thing you should know, especially if you're a young guy, because leg ulcers are more common in men than in female. So that is something you should take note of. Or as a young man, you're prone to leg ulcer. As a young man living with sickle cell, you're more prone to leg ulcer. So you do well to take better care of yourself. Take your water, take your routine drugs, stay hydrated, everything you need to do for a better life. Now, there's this day I was talking with a young guy, and I told him, a young warrior, and I told him, see, be very, very selfish about your space. Yes, be very selfish about your space, because you alone know what you stand to lose or what you stand to gain. Let's say you're traveling in a bus and the place is tight. Maybe they come, they see that you're slim and all of that. They don't want to push you, or they want to keep you in a place that inconveniences you. If you let yourself just go with the flow, for you it is worse because blood, any small trigger, any change, any trauma, anything, blood stops flowing as it ought to in your body. So whenever you're in situations like that, be very, very selfish about your space. Make sure you have enough air. Make sure your blood is circulating around your body. And I'm not just talking about external forces. When you're moving around, if you're traveling, there's no need to go and start wearing tight clothes, especially to wear tight trousers when traveling. Sometimes it's even better, even for cold, you could just wear shorts so that blood is flowing properly. Don't go and wear tight sandals or sneakers, all those things if you're traveling, so that blood will be flowing the way it should in your body. And you try to stretch your leg from time to time. Whenever you get back home, anyway, we'll get to all of this. Whenever you get back home, stay keeping your leg elevated and all of that. We'll still get to all of that. So other causes of leg ulcers include, traumas. Like I said, external this thing could cause that. Insect bites. Something as small as an insect bite can actually trigger leg ulcer. Yes, I'm not joking. Then you have nail. Maybe you got punctured by nail or pin or something like that, and you don't treat it properly. So even when they finish treating it, somehow later in life, something triggers that spot and it opens up. And I'm talking I've from experience, I've known about people where this thing then triggered leg ulcers in them. So then we also have inflammation, that's swelling. If you notice that you're constantly having swelling around your ankle, not just your ankle, every part of your body is important. So, it's better you just go to the hospital. Let it be that you wasted your time going there. Let it be a waste of effort. Than for you to neglect that thing and then it comes back to get you. So it's better that you just, some people they'll tell you, this thing is not that serious now. Why do I need to start going to hospital, or why do I need to go to see a doctor or something? You understand? But the truth is, to you, it may not be serious, but that small thing, a medical practitioner seeing it would see that's the very first step of preventing something that would have gone way, that would have been blown out of proportion. You understand? So if you notice any slight change in your body, dear warriors, please go to the hospital. Please. So, or you seek medical counsel. So that's those are part of the causes, those swelling. So if you're always noticing swelling around your ankle, please go and see a doctor. It could be the very first step to arresting this leg ulcer. Aside from leg ulcer, any other thing. Then other causes. Now we have what we call venous insufficiency, and not just in people with sickle cell. We have some people that are prone to that. So now venous insufficiency is the inability of the blood to flow back from your leg back to your upper body. So in situation like that, maybe the cell there is blocked or something, this thing that so it gets stuck. Like I said, the blood is not flowing very well around your body, you get to see leg ulcer. So if venous insufficiency, the blood is not moving, oxygen is not getting to where it should get to, leg ulcer comes up. So these are the major causes of leg ulcer. These are the causes of leg ulcer. So if you tend to notice anything, even a wound, that something as minor as mosquito bite, please pay attention to it, especially from your knee down to your ankle. Pay close attention to things that go on in that axis. Okay, so signs and symptoms of leg ulcers in people with sickle cell. So, one of the very first thing you may notice for some persons, one of the things you will notice first when it comes to leg ulcer is hardening of the tissue around that skin. For those that it's their ankle or wherever, anywhere from your knee down to your ankle is prone to leg ulcers, right? I mentioned that earlier. So, one of the signs you would notice would be the hardening of the tissue around there. If you touch it, it's a bit hard or stiff or coarse for some persons. So, that's the first sign for people. So whenever you notice symptoms like that, not just as it relates to leg ulcer, just any part of your body, please contact a medical practitioner immediately, because what you feel may just be something you could disregard, maybe a very important sign that could stop something from getting out of, blowing out of proportion. Then another thing you would notice after that skin hardening is swelling around that area. So you notice the skin there, that place. Let me use the ankle because the ankle is more common. Like not really the ankle, just between I'm going to put a picture to show that. So between just a little bit above your ankle, you'll see for most persons that's the place it happens. While for some persons it's around that area. So you start to notice the area swelling. Don't disregard the swelling. But the thing is, the swelling does not just come like that though. For people even with sickle cell, the swelling starts by maybe you go out the first day, you stress yourself and you come back, or maybe you go to work, you go to school, or you stand for long and all of that. You notice that place is swelling. But because you rested and then the swelling went down, you're okay. You go out again, the place starts to, you notice it's swelling. You still disregard it. And not just the swelling, another thing that you also notice in that area is that the skin around there starts to change color. For some people, it's not becoming darker. For some persons, it's not becoming darker than your normal skin color. You would observe it. Now, that discoloration is that the cells in that area are beginning to die off. the cells are beginning to die off. Like oxygen is not getting to most of your cells in that region. So the color start changing. It's giving you a sign. Your body is telling you, I'm in need of air, I'm in need of oxygen. But maybe you choose to disregard it at that point in time. But this is part of what I want to educate us on. Do not disregard changes in your body. It's very important, irrespective of how minute you think those changes are. So with time, the swelling begin to, it's no longer just it's no longer just few minutes swelling and then it goes down. It takes longer to go down, and it even lasts way longer than before the onset, even when you are no longer, stressing yourself as before. But the main thing is maybe you stand for just a little bit of time, your body, the swelling starts. You understand? So with time, it increases in the way it begins to occur. And the next thing you notice is that the wound in that area, or for some persons that already have wound, the wound start to, expand, start becoming bigger, start becoming deeper, and all of that. But for some persons, at that point in time, that place burst. A place, it's one tiny spot that's going to burst open. Now, if it bursts open and you still don't treat it, from it being open, it starts to expand also. That is the onset of infection, because now bacteria and every other microorganism is getting into that place and the wound becomes infected. So, my dear warriors, whenever we notice signs like this, please seek medical help immediately. So for the treatment of leg ulcer, I won't really be discussing about all of that here. I'll only be providing hints. I'll only be providing, helpful tips on how you can better take care of yourself and manage yourself, or protect yourself, or prevent leg ulcers. And then for those with leg ulcers, it will help you in treatment of leg ulcer. But it is not that this is where to treat the leg ulcer. Please visit the hospital. Go there, meet a medical practitioner. They will guide you. They're in a better state to assess your body, ascertain what is needed, and then provide necessary care and treatment options for you. But what you should know as a sickle cell warrior is this: your nutrition plays a very vital role. And like in the case of that young man, it was very easy for them to tell me, because I asked, why is his leg ulcer like that? They told me, this man doesn't take his routine drugs. A 24-year-old man, because to me, you're no longer a child at that state. And people are there already saying, you don't need to take your routine drugs, you don't do this, you don't do that. Like they know you, that you don't do this, but you're suffering in pains. And the irony is, your routine drugs will actually help you with that. Nutrition is very, very important, but most people, they skip up on that. You see, you may be treating your leg ulcer from now to next year. If you're not doing the proper thing, it will not go, it will not heal. It may likely not heal. That's the truth. So, and another thing most people don't understand is this: ulcer takes a long time to heal. You don't just start the process today and expect it to go immediately. So for some persons, once they start it, they give up. Some people, it takes months. Some people, it takes years. It didn't just start one day. It was growing and nothing was being done at first. Or you did something, but somehow exposed yourself to part of the triggers, and then it wasn't. But the main thing is you need to give it time. So I'll also be using this opportunity to talk to us about antibiotic abuse, because most people, once they start noticing those kind of things, ampiclox, ampicillin, all of that, that's not the way to go. It's one of the first things that they will do when they want to treat leg ulcers at the hospitals. One of the things they do is like the very first process, it's one of the first processes there, is to send you for microbial wound culture and sensitivity test. Why? Because at this point in time, we want to know what are the best antibacterial that we're supposed to give to you in this situation, which you are no longer resistant to, which you are not resistant to. Because some of you have abused antibiotics to the point that it's very difficult to find one that can actually tackle like a minor illness, a minor thing that a small antibiotic can do. We'll have to now go and start looking for those high class antibiotics to use, because you have completely abused everything. And now, when treating leg ulcers, we have to run that test. They have to run the test to be sure that we are using the right antibiotics. Because if they use the wrong one from now till next year, my dear, nothing will change. Because it's just there in your body, you're just taking it, and it's even worsening situation of things in your body. Nothing will change until you use the right antibiotics. Do you understand? So when some of you want to give up on all these healing processes, ask yourself, have the right thing been done? So for some persons, another thing that you will see them do is wound debridement. So basically what they are going to do at that point in time is to, scrape off those dead cells that are there, so that the treatments, the wound dressing, the medication, everything could actually penetrate better. And that's a very painful process actually. So, but it's a necessary process for some people. Then, like I mentioned earlier, your nutrition, at this point in time, you need to be eating well. Fruits, vegetables, and that's not the time to start doing diet plan or you're going on a diet. No, you need to eat very well. fibers, all of that. You need to build up your system. You need to focus on building your immune system at that point in time. Zinc, vitamin C, all the necessary things to build up. Your doctor is going to guide you better on what to do at this point. So you need to be taking things that will help to build your immune system. You need to stay hydrated at all points. And then please, I know it may be very difficult, especially for those of us that are going to work, that are students and all of that, but please reduce the amount of stress you are passing through at that point. I know it's difficult, but it's like I told someone one time, for the sake of the longer game, just suffer it now. You understand? When you need to take excuse, reach out to people for support, reach out to maybe where you're working, your superiors, you're at school. You understand? At this point in time, you need to reach out to people to help you for certain things, like some things that you may need to, instead of you going to go and do those things yourself, you delegate so that you have enough time to rest, because rest is a very vital process for that wound healing. So please, enough rest, enough stay hydrated at all times. Rest, very important. And once you're at home, most of the time, you keep that your leg elevated to to the heart level. You see, I think they will put you through on how to better take care of it. And then the wound cleaning, when necessary, you go to the hospital. And in some cases, if it's something that you cannot always visit the hospital for proper wound cleaning every time, you may reach out to the nurses there or to the clinician there to see how they could put you through on the necessary things you could do on your own, so that you don't have to go there every day to clean the wound you're at the hospital, where you can avoid that. And I think that's basically everything you need to know about that. And like I said, you're between drugs, and make sure that you are in a situation where blood is flowing regularly. It doesn't mean that during this process you will not do anything, you will not move around. No, where you can, you try and exercise that leg, exercise it to also aid the wound healing process. And I believe if you do all this right, God being by your side, you know, you're going to get good results.